Back to my channel. Today I have decided to recall a few of my important notes, and here I compiled the cardiovascular system from the chapter of physiology. And let's see, these are the high yield points and also a summary of the cardiovascular system. So let's start with the volume. The blood volume, it increases by 40 to 50%, and plasma volume increases by 45%, and it is maximum at 32 weeks of gestation. And moving towards the cardiac output, and it increases by 40%, which is 4.5 to 6 liters per minute. And cardiac output is equal to stroke volume into heart rate. Heart rate increases 10 to 15% or 10 to 15 beats per minute, and stroke volume, it increases by 25 to 30%. And moving towards the peripheral vascular resistance, because of the decreased peripheral vascular resistance, there is a decrease in the blood pressure, and it is 5 millimeter of the mercury diastolic and 10 millimeter of the mercury systolic. And there occurs a supine hypertension due to the gravid uterus. It is known as supine hypotensive syndrome. And in pregnancies, there is a decrease in the peripheral vascular resistance due to progesterones on the arterial smooth muscles, and also along with the increased nitric oxide and increased prostaglandin I2 and asymmetric dimethyl arginine, which is also known as ADMA, and they are the vasodilators. Now let's move towards the benign conditions of the cardiovascular system which occurs during the pregnancy. These are the third heart sounds, the systolic flow murmurs, and left axis deviation, which is about 15%, and sagging ST segment, and inversion or flattening of the T waves in lead 3 and Q wave in the lead 3 and AVF. And moving towards the red cell mass, and these red cell mass these are the hematological changes. And the red cell mass, it increases to 20 to 30%, and because of the increased erythropoietin and increased placental lactogen, there is a decreased hemoglobin and a decreased hematocrit due to increased plasma volume, and this is known as a physiological anemia at 32 weeks of the gestation. And along with that, there are the increased WBCs, which are the neutrophils, and the gestational thrombocytopenia is due to the increased destructions of the platelet. It is not caused by the immune factors and increased platelet turnover. Now the hypercoagulable state, as we all know that pregnancy is a hypercoagulable state, and here it is and the factors which remains unchanged, they are the 2, 5, 9 and 11. And the factors which increases, they are the 7, 8, 10. Von Willebrand factors increase fibrinogenol levels and increase FTPs, D dimers, and increase ESR. The decrease factors are the 13. It is the only factor which decreases in the pregnancy, and there is a decreased fibrinolytic activity. And now the iron metabolism, the demand, it increases it increases to 1000 milligram, and extra required 4 milligram per day, and only there is 10 to 20% ingested iron is absorbed, and this causes the iron deficiency anemia. It is the most common cause, and it is the most common hematological problem in the pregnancy. Investigations includes the serum iron, which is less than 12 millimole per liter, and the total iron binding capacity, which is less than 15%. And few more important points, that pathology for pregnancy is that it increases the response to the angiotensin, and the volume of the blood increases in normal pregnancy is equal to 25 milliliter per kg, and cardiac smooth muscles, they carries the impulses from the sinoatrial nodes to the AV nodes. So this concludes our today's revision, and this revision is basically the high yield points, and I'm going to compile these points, and will make videos upon one by one system. So stay tuned, and if you like the video, kindly share and subscribe my channel. Till that time, take care. Bye bye. Allah Hafiz.